Well, not just the cost, but what is included in the proposed health care reform plan has led to misconceptions being spread about what's in the plan. Tonight, in our week-long look at your health care checkup, we aim to set the record straight by examining the criticisms of the reform plan. With different versions of a health care plan making its way through Congress, it's no wonder constituents and congressmen at town hall meetings are interpreting what's at stake differently. One big concern, a government program might ration health care, and some individuals might not get what they need or want. Congressman Steve Kagan says that's not true.
That is not the intent of this piece of legislation. These new ideas about health care reform are to fix what's broken and keep what works, and improve it at a lower cost.
But Congressman Tom Petri points out rationing takes place now, for example, with those who get shots or organ donations. And he says if funding for health care reform isn't there, we could see more.
There's not enough money to pay for what's promised, and you end up going to rationing, or either openly or delays, waiting 3 months to get this service or that service.
So nobody's going to be denied coverage for something that they need?
Absolutely not.
Another concern is the reform encourages euthanasia for seniors. Not true. The plan does outline paying doctors for consulting with patients about private end-of-life decisions in what is described as advanced planning consultations.
You know, you talk about misrepresenting what is real. This was a Republican idea. It is a fantastic idea. For the very first time, Medicare would compensate a doctor for sitting down to listen to the choices that his or her patient wants to make.
Petri says many of the provisions in the plan are undefined, and constituents are coming forth with the right concerns.
I think people are trying to understand what this is and how it would work, and I think that the truth is that right now it's not clearly defined.
I'd say don't scare people. Reassure them with the facts, with the truth.
The $1 trillion cost also remains a criticism. Kagan says the plan will stimulate the economy and create jobs. Petri says just the opposite.
Our economy needs an economic stimulus by reducing costs for health care.
I don't really think we should be approaching health care reform as a temporary economic stimulus package. It's an ongoing human need.